So there is a new fight over Obamacare and a dramatic reversal. The Trump administration now telling a federal appeals court they want the entire law struck down. Now, if the courts agree, insurance for millions of Americans could be in jeopardy. Joining us this morning to talk about it, healthcare specialist Seth Denson. And Seth, the president tweeting out yesterday, the Republican Party will become the party of healthcare. I think the big question everyone has, why is the Trump administration so hell-bent on getting rid of this, and why now?
Well, listen, the Trump administration has made healthcare a top priority since it came into power. Whether it be Health and Human Services Secretary Steve Azar focusing on prescription drugs, or the Trump administration really pushing to overturn the Affordable Care Act. He campaigned on this, and it's always been one of those things he's wanted to go after. Unfortunately, the Republicans just can't get their act together and figure out what they want to do to solve health care. Everybody's got various ideas, but nobody can come together and consolidate those ideas. And we saw what happened, last year, where Republicans just failed to get anything done in Congress and therefore took a hit in the midterms and really lost power in large part because Democrats seized on the opportunity to bring health care back into focus for those Americans that are receiving benefits from the ACA.
Well, take us back a little bit. Let's rewind and take us back to square one, where this battle kind of began to try to get rid of Obamacare to begin with.
Yeah, so this most recent battle actually was back in December, and it feels like it was an eternity ago, but it was only a few months, where a federal judge ruled in favor of numerous states, including Texas, where the federal judge resided, that because of the Tax Cuts and Jobs Act that was passed in 2017, which reduced the individual mandate to $0, okay, this is one of the things that Republicans were able to do to impact the ACA. But because of that, then the previous Supreme Court ruling where Justice Roberts said that Congress does have the right to tax through the ACA for not having health insurance was no longer valid because Americans who wanted to comply with the Affordable Care Act were required to either buy health insurance or pay a tax. Well, since the tax went away, the original Supreme Court ruling was invalidated. This happened back in December and is making its way through the appellate courts. And so what that judge ruled was because the individual mandate is no longer applicable because there's no cost to it, then the entire law needed to be thrown out. What has happened recently was just this week, the Trump administration, the Department of Justice has come out and said, we agree with the ruling out of Texas, therefore we are not going to defend the merits of the ACA in the appellate courts.
So how many people are we talking could this affect?
Well, there's more than 10 million, close to 11 million that are receiving benefits through the exchanges and open markets and things. But when you start to expand on things like Medicaid expansion, the elimination of pre-existing conditions, you're talking about 32 million-ish people that are positively impacted by the Affordable Care Act and some of the provisions within it.
Yeah, well, you just mentioned a couple of the provisions. Kind of expand on that a little, because I think when, a lot of people just think we're just talking about their individual health plans. We're not. There's a lot of other things that could be impacted.
That's right. So a couple of the key provisions of the Affordable Care Act were the elimination of pre-existing conditions, right? If I've had a condition or I have a condition, insurance companies can't deny me access to coverage. Guarantee issues of policies, right, without what we call rate-ups. I can't be underwritten in a way that my health insurance premiums are 10 times the amount that I would ever use in healthcare, although we can make some arguments that that's happening in some cases for healthy people. Provisions like kids can stay on their parents' plans to age 26. And then there's certain provisions that say, here's how health insurance has to operate. These were called the essential health benefits, the things that every insurance policy had to cover so that Americans that bought insurance policies would know what they're getting into. And so these types of things, if the Affordable Care Act were eliminated, would go away. And the timing is just the key there. Is what would that rollout look like? It took 4 years to implement the Affordable Care Act because you got to remember, the markets had to adjust. The insurance markets had to come out with new policies. Healthcare markets had to realize how they were going to bill for services and all of this. So if this ruling out of Texas is upheld and makes it through the Supreme Court, I likely think it will. I think the Fifth Circuit, which is an extremely conservative circuit, will find on the merits of the ruling out of Texas. It will make its way to Supreme Court, which will be the third time the Affordable Care Act has made it its way to the Supreme Court. And the key focus is going to be on Justice Roberts, who was the swing vote upholding the constitutionality of the Affordable Care Act in the previous court rulings.
All right, so then we roll back to what I initially said right at the beginning when we first started talking. President tweeted yesterday and said in front of a group of people as well, the Republican Party will become the party of healthcare. If this is completely gone, if they repeal it, what's their plan? What are they going to do?
Your guess is as good as mine. And, here's the challenge that Republicans face. Republicans have become the party of all or nothing, unfortunately. And that's really what happened when they tried to come together on health care. They couldn't come together because everybody wanted what they wanted. And the challenge that Republicans have, and this is where the Republicans really need to focus their attention. If they were asking me for my advice, here's how I would advise Republican lawmakers, is that the problems within the healthcare markets are not the insurance markets. Insurance markets are the financial institutions that finance healthcare. The problems are the actual cost drivers of healthcare. It is expensive in the United States, and it doesn't have to be. This is crony capitalism at its best, and the consumer can't become a good consumer. We have a free market system and a great one. We need to allow the consumer access to things like pricing transparency and access to markets that work based on outcomes, not based on tests. And if the Republicans would get together and focus on the few key things to do this, we could bring down the cost of healthcare, which means everything else that stems from that would work more effectively and efficiently.
Healthcare strategist Seth Denson, thank you so much for joining us today on Washington's WONK FM.
Thanks for having me on.